Let's go into the complications of ulcer. Number one on my list is internal bleeding. When there's an extensive wound in the gastrointestinal tract, it can make blood to leave the wound site and touch other organs in the abdomen and cause anemia. And you know that anemia is a shortage of blood. When a person starts vomiting blood and stolen blood, you know it reduces the blood in the person automatically, and this can lead to anemia. And if this case is not quickly arrested, it can even cost the life of this patient. Number two on my list is perforation. When peptic ulcer is not properly managed, it can lead to complications which can cause the wound or the sores to form a hole in the stomach, the duodenum, or even the esophagus of the person, and this will make sterile content from the stomach to go into the sterile cavity of the abdomen. And when this happens, it's not usually good. When this happens, then you should be expecting infection. Number three on my list is the formation of fibrosis. When there's too much wound in the abdominal cavity of the site of the corrosion, be it the duodenum, be it the esophagus, be it the abdomen, this can form fibrosis which can obstruct the normal flow of the GIT passages. And when this happens, it's usually a serious problem for the patient. Number four on my list is the penetration of the vital organs. This is very, very dangerous. When the peptic ulcer is allowed to linger or to stay in the patient for so long, it can go through the muscular wall of the stomach, the duodenum, or the esophagus, depending on the site of the corrosion, and penetrate into the vital organs of the person, such as the liver, the pancreas. And when this happens, it can cause an intense piercing pain, especially at the back or the areas affected, most especially when someone wants to stand up or sit down, because these pains will affect your positions, your standing or sitting positions. Number five on my list is peritonitis. When perforation occurs, remember I told you about perforation, the content of the intestine travels from where they are supposed to stay into the sterile cavity, abdominal cavity. When this happens, infections occurs, and when these infections are usually very stubborn to go. It requires a very strong antibiotics to clear up the infection or the microorganism from the cavity and the blood. Now let's look into the treatment of this ulcer. We have two major treatments. We have the lifestyle management and we have the drug management. I'll emphasize on the lifestyle management. In lifestyle management, there are some things you need to do if you know you have ulcer, in order not to be causing this crisis to be coming frequently. Number one is avoid large meals. Small frequent meals are recommended if you have ulcer. This is because it will help you. Your stomach will be light and your stomach will not be too heavy to cause this crisis to be coming up. Number two on my list is avoid eating or drinking anything within 2 hours before going to bed. This one is very, very important, because when you eat immediately and lie down, you are only bringing this indigestion, heartburn to start occurring. But when you know you're sleeping by 8 o'clock, you should eat by 6 or a few minutes past 6, so that before you go to bed, before you lie down, your food might have digested, and your system might have adjusted before you can lie down. It is very, very important. Number three on my list is limit food and drinks that triggers these symptoms, such as spicy food, especially food with pepper, things like citrus juice such as lemon, lime, oranges. Even if you have to take orange, just take it in a very small quantity. We have carbonated drinks, these minerals. Be conscious if you are taking. We have caffeine, we have alcohol, peppermint. If you know you have ulcer, please limit, or if possible avoid the intake of these things. Number four on my list is avoid smoking. If you smoke and you have ulcer, you're not helping yourself. Another line of management is to chew gum. It sounds funny, but yeah, it works. Studies have shown that by chewing gum, it stimulates the secretion of the bicarbonate containing the saliva, which will help neutralize the effect of this gastric acid in your stomach. So, like you are chewing gum, your system will feel like, oh, something is coming. Another line of treatment and management is the use of drugs. We have drugs that can be used to manage and treat this ulcer. They come in suspensions, as tablets, as capsules, and also as injections. Some come as a single drug, while some come as triple therapy treatment. So I advise you visit your hospital or your pharmacy for them to recommend the best option for you. So if you found this video helpful, please, I beg you to share this video to people that you think that may need this video. And also don't forget to like and subscribe to our channel, and most importantly, click on the notification button to be notified the next time we shall post insightful videos like this.